We are honored to welcome U.S. Senator Richard Blumenthal. Thank you, Senator Blumenthal, for your continued leadership throughout the COVID-19 pandemic. It truly has been an unprecedented challenge for all of us in healthcare. We continue to rely on our leaders like you to be our voice and advocate for our healthcare systems. Thank you to my fellow St. Francis Hospital leaders, to our Trinity Health of New England leadership teams, many of whom are here today. And I just want to take a moment again, because I don't think we can do this enough, and thank our colleagues here at St. Francis Hospital, individuals who remain steadfast in the face of the pandemic. I am truly honored each and every day to work alongside each of you as you continue to prove to all of us that you are heroes. Since the onset of the pandemic, keeping our mission in the forefront of our thinking has provided us with ongoing strength and commitment to serving in our communities. These months have tested us, and as we see numbers rising every day, we are reminded of the incredible strength and stamina that our colleagues demonstrate day after day after day. At Trinity Health of New England, we pride ourselves on our ability to provide equitable care for all community members. We have been providing accessible COVID-19 testing throughout our region for the past 8 months with absolutely no signs of slowing down. This is thanks to the leadership of our regional and local teams and our colleagues. Throughout Connecticut, Trinity Health of New England continues to operate 3 drive-through sites and a mobile testing program in partnership with Charter Oak Health Center. Locally and regionally, we remain committed to serve our community by providing testing opportunities for all for as long as it is needed. And now to give us a deeper insight into the importance of testing and proper PPE, it gives me great pleasure to introduce Dr. Jessica Abrantes Figueredo, our Chief of Infectious Disease at St. Francis Hospital.
Thank you, Tom, and welcome, Senator Blumenthal. St. Francis is proud to be a part of a national healthcare system, Trinity Health. This affords us the opportunity to tap into critical resources, such as access to limited PPE supplies, which proved valuable at the onset of the pandemic. The last 8 months have allowed us to learn, innovate, and adapt as we work tirelessly to better understand the virus, how to treat it, and how to best keep patients, colleagues, and the community safe. What we knew early on was the importance of testing. Trinity Health of New England has provided COVID-19 testing to more than 100,000 community members. We are proud to say, according to the Department of Public Health, we were the first drive-through testing site approved and open to the public when COVID-19 began entering our state. At each of our locations, we test all members of the community in need of a COVID-19 test, including ages 6 months and older. In order to accomplish this, we've worked diligently to meet the demands of testing. This means there are multiple components that must be available in order to effectively perform a COVID-19 test: lab capacity, reagents, test kits, and key staffing. Early on, there were many issues with availability, and while that has improved significantly, it is still an issue that needs to be addressed. We have expanded to using multiple testing platforms to be available for our patients and community. Each component impacts turnaround time for testing results. Why are quick turnaround testing times important for hospitals? Well, the sooner we have tests available and a result, the more efficiently and appropriately we can treat our patients. Long turnaround times can lead to higher PPE use that has been deemed so valuable during this pandemic. Why are quick turnaround times important for the health and safety of our community? Well, testing allows us to assess positive cases so that we can appropriately counsel patients on the need for isolation or quarantine based on active infection or exposures so that we may quickly stop the spread. I will close by sending this very important message to the people of Connecticut. We understand and acknowledge the pandemic fatigue we are all experiencing. It's showing in the number of hospitalizations and the positivity rate. We cannot become complacent. We know that masks work. We know that hand washing works. We know that limiting indoor social gatherings works to reduce the spread of the virus. We urge you to remain vigilant in your efforts to help lower the spread in our community. If you have any questions related to the virus or the second surge, you can call our COVID community hotline 7 days a week, 8 a.m. to 5 p.m. at 1-888-786-2790. Thank you, Senator Blumenthal, for continuing to bring attention to the need for easily accessible PPE, ongoing testing, expanding testing capacity, and thank you to my colleagues for all the work you do today and every day.
I want to thank Tom Burke and Dr. Abrantes Figueredo for their leadership, but really everybody who works in this building, all the docs, nurses, administrative staff, clinical people, all of the folks who have been caring so diligently for Connecticut people over these past months. We are in the midst of an impending surge comparable to what we saw in March, which cost us lives. There was a reason for that crisis in March, which was that no one could foresee it. We now have foreseen the crisis that is impending. Epidemiologists, public health experts, scientists have been warning us for months that we face a second surge. That second surge is here, and we have no vaccine and no therapeutics to combat it fully. What we need is testing with rapid results, quick turnarounds, and in fact, we face tightening supplies of testing materials. That's right, tightening supplies of the materials like antigens, equipment, and staff that are necessary for sufficient testing with quick turnarounds. This problem is national in scope. We've been warning about it for months. The President's task force has been silent. The federal government has been inert. We need action now, and there are ways to do it. The Defense Production Act is a path to quick manufacturing of these supplies. We need to invoke it. I've introduced legislation along with colleagues that would compel the President to make use of the Defense Production Act to produce more testing supplies and equipment. We also have the HEROES Act that has $75 billion for testing equipment, as well as PPE. This crisis is a public health menace expanding exponentially in scope. And Dr. Abrantes Figueredo put it very well. Common sense as well as science shows that the way to combat it is to know who's infected, to stop the spread, to have students, teachers, families, people at work, all of us undergo testing whenever we have symptoms and whenever we are in contact with someone who has tested positive. Contact tracing is critical. But we will face severe shortages of PPE, testing supplies, and other essential infrastructure. The way to combat this deadly insidious disease is to develop the supplies and equipment we need right away. In the absence of sufficient therapeutics and a vaccine, the common sense ways to stop it are PPE, testing, as well as mask wearing, physical distancing, and other similar steps. So very grateful to Trinity Health and St. Francis for their leadership on this issue. Other hospitals have expressed the same kind of apprehensions. The people of Connecticut are rightly fearful about this second surge, and they deserve sufficient testing supplies and equipment so we can forestall the thousands of infections and deaths that may happen. Already at the national level, the number of daily infections is exceeding 140,000. The number of deaths now is way above 1,000. The number of hospitalizations, 65,000 or more. These same kinds of increases are reflected in Connecticut. There's no mystery here, unfortunately and tragically. We face a second surge right now, which will expand geometrically between now and January 20th, when a new president will be sworn in. Before that inaugural, we need action. And I'm hoping that we will see it from the Congress and from the White House. Happy to take any questions.
Senator, the Defense Production Act would obviously help boost, needed supplies, PPE, and all these areas, but it doesn't guarantee that medical providers are going to purchase PPE from American companies. They could source it cheaper from China or Korea. So what do we need to do to make sure that companies are actually purchasing USA-made products?
The Defense Production Act envisions manufacturing made in America, and it provides funds so that companies can convert to produce not only testing equipment, but also ventilators and other essential medical supplies produced right here in America. But that's an excellent question. We need to develop the supply chain here in America, so we are not dependent on South Korea or China.
Do you anticipate there being deficiencies in with this vaccine coming out? We're going to need needles, we're going to need alcohol wipes, all those other ancillary products that go along with the delivery of the vaccine.
I think, we have good news in the development, apparently, of a vaccine that is reaching the point where it will be found to be safe and effective. That's good news. The challenge will be, as I've indicated and others, in making sure that it's manufactured and delivered in the millions of doses that will be necessary, and assuring the public that they can trust it. So, again, the supply chain. It doesn't happen by magic. It has to be developed through investment. That's the whole purpose of the Defense Production Act. And it has to be, in effect, built through investment by the federal government. Obviously, private enterprise can help, but our federal government has to take responsibility. We need a federal government that is fully engaged. And before this president leaves, before the White House changes hands, we need that investment to begin, because this pandemic is not pausing. The COVID-19 doesn't really care about changes in the occupant of the White House. It is raging and potentially savaging this nation, even in the 2 months that we have before January 20th.
It's been more than 7 months since Americans got those first round of direct payments. People are still in need of that. They're still losing their jobs. Do you foresee a deal getting done even before President Biden or President-elect Biden comes into office?
We could do a deal before Thanksgiving. We could do a deal certainly before the holidays. And it really just takes Mitch McConnell coming to the table and being realistic about what is necessary, including the $75 billion for more testing, the $100 billion investing in hospitals exactly like this one. That $100 billion is a minimum, but it's not in the McConnell proposal. It is in the HEROES Act. We're willing to compromise. We'll be reasonable. We'll come to the table. Mitch McConnell has been absent, completely absent from the table. So another round of stimulus payments, aid for state and local governments, more testing equipment, aid for hospitals, small businesses. All of it is possible by Thanksgiving if Mitch McConnell will come to the table. Okay, thanks everyone.
Thank you, everyone, for coming this morning. I do want to once again thank Dr. Phil Rowland, who's not able to be here, our Chief Medical Officer. Again, Dr. Jessica Abrantes Figueredo, and also behind me, Dr. Mazo and Dr. Hussein for their continued service, and especially Senator Blumenthal for being here again, for your advocacy, your leadership, and being our voice. Thank you.
Thank you.
Thanks, everyone.